Hello, and welcome to the Kane County Health Department Infection Control Training Series. Today, we would like to talk about your role in preventing the spread of infectious diseases in healthcare. We tend to think that preventing diseases is only the job of clinical people such as nurses and doctors, but each person working, visiting, or living at a healthcare facility has the responsibility of doing what is necessary to avoid passing germs to others. Let's quickly look into how germs spread and cause disease. There are three important things we need to consider when thinking of how people get sick from germs. First, germs can live anywhere, like in the human body, on surfaces, in water, dirt, or animals. We call these reservoirs. But germs can't walk around and come into people's bodies on their own. They need a way to travel from one site to another, or pathways. Examples of pathways are medical instruments and devices, people's hands, and even the air. Germs also need to be able to survive on surfaces and objects so they can cause infection. Then they need a person to infect. And when in a person's body, they need to be able to work around the body's natural defenses to make them sick. To stop the spread of infections, we must act on all of these fronts, reducing or eliminating germs in potential reservoirs, controlling the ways for organisms to gain access to people, utilizing effective ways to control the presence and growth of germs on surfaces and objects, and ensuring people's bodies are in their best shape to keep germs out and fight them off appropriately when necessary. People can get sick from germs anywhere, but the chances of getting an infection are not the same within all types of environments. For instance, the chances of acquiring an infection are much higher for people in hospitals and nursing homes because, first, people in these places are frequently already sick with germs, and two, because their bodies are frequently less able to fight off these germs and infections in general. So, how do germs spread in healthcare settings? The most common way germs move from one place to another is through the hands of people. This includes healthcare workers, visitors, and residents. You touch your mouth, then a door handle. You shake hands with the visitor, then help a resident up from a chair. You flush the toilet, then touch a wheelchair's handle. Another way of spreading germs is through breathing. If someone near you has a respiratory illness, they expel tiny little droplets when breathing out, and you may breathe these droplets in. Splashes from contaminated fluids when flushing toilets, or splashes around sinks when draining liquids, or washing contaminated objects and even hands can also spread germs to other people, objects, and surfaces. A person sneezing can produce a spray that generates thousands of infecting particles in the air, which may then sit on surfaces and contaminate other people. In long-term care, patients receive a variety of services, including medical. There is always the risk of a patient to become infected by a germ during a dressing change or when receiving IV medication. Patients in healthcare facilities are also more likely to have invasive devices such as catheters, lines, and feeding tubes in their bodies as part of their medical care, which makes them more vulnerable to infections. It is very important to keep all of these instances in which transmission of infection may happen into consideration, not only for the protection of patients and residents, but for the safety of workers as well. It is impossible to talk about preventing infections without bringing hand hygiene into the conversation. Why? Contaminated hands are the primary and most frequent reason why infections are transmitted between people. This is especially true in healthcare. As much as we might think our hands are mostly clean and harmless, we touch objects and surfaces all the time, and there are so many germs there that unfortunately we are unable to see. You might not realize, but contact with fecal matter or poop is much more frequent than you think. Contact with dirty surfaces happens hundreds of times in a single day. So without even noticing, we may be helping to carry harmful organisms from a site into a person's body. If this person is someone who's already sick and weak, this means placing them at risk for serious illness. This is why frequent hand hygiene is key to protect everyone in healthcare. Did you know that during one work shift, a healthcare worker may need to perform hand hygiene over 100 times? Performing hand hygiene correctly and timely is essential. You must always keep in mind that hand washing is the preferred method of hand hygiene whenever the hands are visibly dirty or when dealing with some specific organisms like norovirus, for example. In general, however, using hand sanitizer is the recommended method to clean your hands in healthcare facilities. The major issues with hand hygiene is that people miss the opportunities to perform it or they don't do it properly. When keeping your hands clean, are you sure you're doing everything right? Let's quickly review the steps to do hand washing properly. First, wet your hands with clean, warm water. Then spread soap all over your hands, ensuring every little spot of skin is covered. Rub the soap over the entire surface of your hands and keep rubbing for at least 20 seconds. You may use the trick of singing happy birthday twice. Rinse your hands thoroughly with water. Make sure to close the faucet using your elbow or a paper towel. And lastly, dry your hands well with a paper towel or using an air dryer. As we said previously, in the majority of circumstances in healthcare facilities, you will use hand sanitizer to clean your hands, so make sure to do it right. First, apply the gel in a quantity enough to cover the entire surface of your hands, then rub your hands together until they're dry. This should take around 20 seconds. Remember to check if the hand sanitizer you are using contains at least 60% alcohol and that it's not expired. You can find this information on the product's label. In hand hygiene, it is key not to miss any opportunity to do it. So practice hand hygiene before touching your eyes, nose, or mouth, before eating or preparing food, before and after touching a patient or a patient's surroundings, after using the toilet, after coughing or blowing your nose, after touching garbage. So we just talked about hand hygiene, one of the most important ways we stop germs from spreading from person to person. But hands aren't the only way germs travel. They also live on surfaces. That's where cleaning and disinfecting come in. Cleaning and disinfecting environmental surfaces are basic but very important and essential parts of infection prevention and control. They help stop the spread of harmful germs in healthcare settings, especially where residents or patients may be more vulnerable. Therefore, these basic things are fundamental in preventing healthcare-associated infections, and both are needed. Let's take a closer look at what each one means. Cleaning means physically removing germs, dirt, and impurities from surfaces or objects. This is usually done using soap or detergent with water. In long-term care settings, cleaning helps reduce the number of germs that could come in contact with residents, staff, or visitors. But here's something important to remember. Cleaning does not kill germs. It just physically removes them from the surface. That's still important though, because the fewer germs there are, the lower the risk of spreading infections. When you wipe down a handrail or a call button with soap and water, you're helping remove germs that hands can pick up and pass around. This is especially important for high-touch surfaces in shared spaces. Disinfection is the next step. We disinfect to kill germs like viruses, bacteria, and fungi that might still be on the surface. This is done using Environmental Protection Agency or EPA registered disinfectants. These are products that have been tested and approved to kill certain germs on specific surfaces. Disinfection is especially important for high-touch areas such as doorknobs, light switches, elevator buttons, and shared equipment. Now, in some cases, cleaning and disinfecting can happen in one step. If you're using a product that is both a cleaner and a disinfectant, and the surface isn't visibly dirty. But if a surface is visibly soiled, it needs to be cleaned first so the disinfectant can work properly. Finally, disinfectants need time to work, what's called contact time. Contact time means how long the disinfectant has to stay wet on the surface to kill the germs that can make residents or staff sick. You might also hear this called wet or dwell time. This time is not a guess. It's printed right on the label of the disinfectant. It all depends on the product. Some need to stay wet for 1 minute, others might need 5 or even 10 minutes. So here's the key point. We should not wipe it dry or let it dry too fast. If the surface dries before the contact time is up, or if we wipe it off too soon, the germs might not be fully killed. That's why we spray enough to keep the surface wet for the full time listed. If needed, we may have to reapply to keep it wet, especially on larger surfaces. This small step makes a big difference in protecting residents who are more vulnerable to infections. So just remember, spray or wipe it, leave it wet, and let it work. That's how we make sure we're not just cleaning, but really disinfecting. Here is a great example of a disinfectant with a clear label. The contact time is easy to spot, so you know exactly how long to leave it on. Simple, but super effective. Now that we have discussed cleaning and disinfection, let's talk about the use of personal protective equipment. Personal protective equipment, or PPE, is specialized clothing or equipment worn to reduce exposures to hazards that can cause you injury or infection. This includes exposure to biological agents like viruses and bacteria, which are common in the healthcare setting. While PPE is often associated with nurses and doctors, it's just as important for non-clinical staff, whether in housekeeping, maintenance, administration, or food services. Non-clinical workers often operate near patient care areas and handle materials or perform tasks that carry risk. For example, a housekeeper cleaning a patient room or a porter transporting waste may be exposed to infectious material. That's why using PPE correctly is just as vital for non-clinical staff as it is for clinical staff. Now, let's go over the types of PPE commonly used by non-clinical staff. Gloves are to be used when touching blood, body fluids, secretions, excretions, or contaminated items from touching mucous membranes and non-intact skin. It is important to select the right size of gloves to provide proper protection. Be sure to change your gloves if they become torn or heavily contaminated. As a reminder, gloves are not a substitute for hand hygiene. Surgical masks and N95 respirators are used during patient care activities likely to generate splashes or sprays of blood, body fluids, secretions, or excretions. Surgical masks are loose-fitting and do not require fit testing. On the other hand, N95 respirators have a tight fit and staff wearing N95s must be fit tested. When properly fitted and donned, minimal leakage occurs around the edges of the N95 with inhalation and provides protection against airborne particles, including large and small particles. Whereas for surgical masks, leakage does occur around the edges of the mask with inhalation. As a result, surgical masks are not a reliable level of protection from inhaling smaller airborne particles and only protect against large droplets. Goggles and face shields offer eye and face protection. Goggles primarily protect the eyes from splashes and sprays, while face shields offer broader protection for the face, including the eyes, nose, and mouth. Gowns are used during procedures and patient care activities when clothing or exposed skin may be in contact with blood or body fluids, secretions, or excretions. Fluid-resistant gowns may be needed in some instances, such as where extensive contamination by blood and/or body fluids is anticipated, or when the patient requires a significant amount of direct care with close skin-to-skin contact. In addition to gowns, overalls and aprons may be used for body protection as well. Shoe covers or non-slip shoes are important to protect from hazards with the potential to cause an infection or injury from the floor. Selection of PPE depends on the potential risk of exposure to a hazard. Therefore, additional PPE may be required to ensure proper protection, such as using hair covers or laser protective eyewear. Just as a reminder, PPE should be worn when cleaning patient areas, handling medical or contaminated waste, delivering food or supplies to isolation rooms, and performing maintenance near clinical zones. Using PPE properly matters just as much as wearing it. You should always perform hand hygiene before and after using PPE. Don PPE in the correct order, usually gown, mask, goggles or shield, then gloves, and remove PPE carefully to avoid contamination. Gloves off first, then gown, goggles, and mask last. PPE should be stored in clean designated areas to prevent contamination. Used PPE must be disposed of correctly. Gloves and masks usually go in regular biohazard waste bins, depending on exposure. Gowns and other contaminated items should follow clinical waste procedures. We all have a responsibility to follow PPE protocols. This means attending trainings, wearing PPE correctly, and reporting issues like shortages or damaged equipment. Your administration is there to support you, and you should never hesitate to ask questions or express concerns about safety. Some common mistakes to avoid when using PPE include reusing disposable PPE. This is unsafe. Touching your face or adjusting your mask with dirty gloves. Wearing PPE in non-designated areas like the cafeteria or staff lounge. And lastly, not wearing the full set of required PPE. Let's be aware of these and avoid these mishaps. Even though as non-clinical staff, you are not providing medical care, you are still part of the infection control team. By wearing PPE properly and consistently, we protect ourselves, our families, patients, and clinical staff. Every role matters in keeping the healthcare environment safe. PPE is more than just gear. It's a barrier that helps prevent harm and spread of infection. Let's continue to support a culture of safety for everyone when working in healthcare facilities. Always follow signage in your department's policies on PPE requirements for specific tasks. Universal signage for different types of transmission-based precautions, or TBP, may be posted in an area or on a patient's room door to alert you of the proper PPE to don upon entering the designated area. The posters shown on this slide include contact precautions, droplet precautions, and airborne precautions, which are used within all healthcare settings. The Enhanced Barrier Precautions poster is used in the long-term care setting. Now let's talk about why it's so important to stay home when you're feeling sick, even if it feels like just a little cold. First, residents and patients are vulnerable. Many of them have weaker immune systems or health problems, so even something mild for us can be very serious for them. Second, germs spread fast in places like this, especially in closed spaces like resident rooms and shared bathrooms. We've seen how quickly things like norovirus or the flu can spread from just one sick person. Third, this is part of our infection control plan. The CDC says long-term care facilities need clear rules to keep sick staff from working, and we need everyone's help to follow them. And finally, this isn't just a nice thing to do, it's required. Facilities can get cited or written up if we don't have and follow these policies. But beyond the rules, it's the right thing to do to keep residents and patients safe. If you're feeling sick, the best thing you can do is stay home and rest. But we also understand that sometimes you may need to be around others, maybe to get medical care or for something urgent. In those cases, please wear a mask to help stop the spread of germs. So the rule of thumb is, if you're sick and around other people, even outside of work, mask up. It's a simple way to protect others, just like you'd want them to protect you. Covering coughs and sneezes can help prevent the spread of respiratory illnesses such as COVID-19, influenza, pertussis or whooping cough, and RSV. Germs can be spread by coughing, sneezing, or talking, touching your face with unwashed hands after touching contaminated surfaces or objects, and by touching surfaces or objects that may be frequently touched by other people. So you ask, what exactly is proper cough etiquette? Well, let's review the actions to take to reduce the spread of germs. First, cover your mouth and nose with a tissue when you cough or sneeze. Be sure to throw the used tissue in the trash. If you do not have a tissue and need to cough and sneeze, use your elbow and not your hands. Last, you will need to wash your hands immediately after blowing your nose, coughing, or sneezing. Washing your hands is one of the most effective ways to prevent yourself and your loved ones from getting sick, especially at key times when you are likely to get and spread germs. The Centers for Disease Control and Prevention, or CDC, has posters available for healthcare facilities and the general community to remind individuals about cough etiquette and how to best prevent the spread of germs when coughing or sneezing. In summary, we saw that there are many important actions that each one of us can take to keep germs away and avoid spreading disease. If you are not feeling well and think you might be sick, don't come to work. It's good for you and to keep others safe as well. Hands must be cleaned all the time, even when they seem already clean. Remember, do not miss any opportunities to perform hand hygiene. Do your part and keep areas around you, including objects you touch frequently, clean. Make sure to use the appropriate disinfectant for the appropriate length of time. If you cough or sneeze, don't forget to use cough etiquette. Cover your cough, but remember, not with your hands. Wear PPE every time you anticipate getting in contact with germs. Know when to wear, what to wear, and how to wear it. Remember that your infection preventionist, or IP, is the go-to person for all infection prevention and control questions. Know who that person is in your organization and follow their recommendations. Keeping an environment that is safe and germ-free is everyone's business. That concludes this training. Thank you for watching. Your role in infection prevention and control is critical to protecting residents, patients, and staff. Your work makes a difference every day.